2021 Excellence in Telehealth Awards Program, or virtual awards event. I am Catherine Pugh. I'm the Assistant Vice President of Policy with Executives for Health Innovation. We actually just rebranded. We were formerly eHealth Initiative. I am pleased to, or EHI, excuse me, is pleased to host the awards event today. I have been on the program committee for the Telehealth Law Forum series hosted by PCI every year for a number of years. We at EHI, we are a multi-stakeholder organization with leaders that we bring together diverse leaders across the nation to really focus on technology and healthcare. I lead our federal policy and advocacy initiatives, including on federal telehealth policy. And I am thrilled to be joining you all today, and also thankful for the work of PCI in Illinois and everyone who is being recognized this year. And so with that, I will turn it over to Lisa for her opening remarks.
Thank you, Catherine, and thank you to your wonderful colleagues at EHI for hosting us today. You've been incredible in organizing this event, and we're incredibly grateful. Welcome, everyone. My name is Lisa Mazer, and I'm the chair of the Partnership for Connected Illinois. On behalf of the board and its amazing executive director, Nancy Kazak, we are so pleased to have you join us to recognize the amazing work and efforts of the awardees who you'll meet today. For those of you who are joining us for the first time and maybe unfamiliar with the partnership, I'd like to tell you just a little bit about PCI and its mission. So PCI is a Illinois nonprofit tax-exempt organization. It was formed many years ago to focus on maximizing broadband access across the state of Illinois. In the past several years, it has expanded significantly to focus on telehealth and to encourage access to telehealth across the state. The purpose of having this awards event is to really recognize those individuals and organizations who have gone above and beyond and meaningfully advanced telehealth in the state of Illinois. The PCI board has formed an awards committee that has met now for several years to evaluate nominations and to select awardees. This year, we received many different submissions for potential awardees and are so proud of the amazing organizations and individuals who were selected and who you will get to meet today. Before we jump into the ceremony, we want to spend a couple minutes just to thank the amazing sponsors, donors, supporting organizations, and also the nominators who went above and beyond in completing our rather rigorous nomination forms. And finally, the awardees, who you'll hear their stories and why it is very clear that they are deserving of the awards that they'll be given. And our sponsors, who we could not do this without their support. We have multiple different levels of sponsors, and each one is recognized on the screen today and has meaningfully contributed to the organization and hosting of this event. We sincerely thank you. And now it's my great honor and pleasure to introduce the wonderful Dr. Suzette McKinney, who's the director of Sterling Bay Life Sciences. So as many of you know, Dr. McKinney is a nationally recognized public health expert. She leads the strategy to expand the Sterling Bay's life sciences footprint nationwide, and she has many other really important functions with Sterling Bay, and also amazing connection for the state of Illinois. She was the former CEO and executive director of the Illinois Medical District, and has had other really important roles within the state. And so with that, I'd like to thank Dr. McKinney for joining us today.
Good afternoon, and thank you so much for that kind introduction. I'd like to spend just a few moments speaking with you today about health equity and why it matters to me. I have always had a helping personality. I remember as a child wanting to be a pediatrician. I love children and I wanted to help people, so I thought being a pediatrician would be a perfect career for me. My interest in public health started when I was an undergraduate student at Brandeis University, and I decided to pursue a degree in public health and a year of experience working in the field of public health prior to medical school. As I got deeper into my public health work, I became more and more in tune to the narrative that the south and west sides of the city of Chicago were the poorest areas in the city, with some of the worst health outcomes in the country. I grew up on the south side and both attended school and worked on the west side. So these are the communities that raised me. Consistently dire accounts of bad health, poor healthcare outcomes, and poverty in these two areas, predominantly inhabited by Black and Brown people, has been the narrative my entire life. So throughout my career, I've progressively worked to use my platform to do something about it. We know that Black and Latino communities suffer from chronic health conditions and poor health outcomes at rates that are disproportionately higher than their white counterparts. We also know that many of these disparities are due to what we call the social determinants of health, which are conditions in the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. These are things like lack of access to jobs, education, substandard housing, and poor neighborhood infrastructure. When we think about what needs to be done, we need to acknowledge and address long-standing policies that have created challenges and alienated these communities from transportation and other social determinants that have severely restricted access to the things that enable them to fully enjoy life, including their health care. Today, we need to be intentional about creating access and opportunity for communities to access education, health care, employment, and social and cultural resources to both elevate and empower these communities from where they originate. We often think of good health as being earned by our individual healthy behaviors or bad luck when we get sick. But I would challenge us all to think about it a little bit differently. For example, good health can be earned by healthy behavior. If diabetes runs in your family, but you want a better outcome for yourself, in order to get that, you might think you need to eat a healthy, balanced diet and incorporate exercise into your routine to manage your weight. But you shouldn't be subject to poor health or a poor diabetes outcome because the neighborhood that you live in is where you can afford to live, and perhaps it doesn't have a grocery store for you to purchase fresh produce or other healthy food, or the community doesn't have a fitness center where you can work out and exercise, or the crime is so high that you don't feel comfortable going outside to exercise. As a society, we should be thinking about how we can come together as business leaders, legislators, healthcare leaders, and just concerned citizens to create the type of change that eliminates barriers to basic human needs in communities where they don't exist. It feels as though it takes major crises like COVID-19 to spark awareness and concern. This pandemic has magnified the inequity in healthcare, with Black and Latino communities experiencing deaths due to COVID at a much higher rate than other groups, as well as other health conditions and comorbidities that weren't being addressed due to the need for social and physical distancing. Telehealth as an industry began to turn this tide in a major way, enabling healthcare providers to see patients remotely and address urgent but non-COVID related illnesses and complaints. I have always felt and continue to believe that true substantive change takes all of us. In public health, we call that a systems approach. This afternoon's honorees collectively are taking a systems approach to ensure telehealth services are available to those who need them, especially those who need them most as a result of economic, geographic, and other social factors that have led to long-standing systemic inequities. I applaud legislators like my good friend, Congresswoman Robin Kelly, for her work to advance policy changes to improve telehealth at the federal level. It is the type of policy changes that Congresswoman Kelly worked on that has enabled low-income minorities to have their telehealth services covered by Medicare and Medicaid. I also applaud the Coalition to Protect Telehealth for its efforts to ensure that access to telehealth services remains in place beyond COVID. I applaud Locust Street Resource Center and Trilogy for working so diligently to utilize telehealth to provide critical mental and behavioral health services to so many who needed it in the face of the pandemic. I also applaud Hep Kessel for her leadership in providing outreach to external organizations to ensure that they could provide necessary telehealth services. And finally, many thanks to Partnership for Connected Illinois for their tireless work to ensure broadband access across the state so that telehealth services could be provided seamlessly and with minimal interruption. In times like these, it truly takes an all-hands approach to care for those among us who are most vulnerable to the trials and tribulations of life. That is what the work of all of these organizations and individuals is doing. I encourage us all to take a step back each and every day to ask ourselves, what can we be doing individually or within our workplaces to make life a little better for others? Congratulations once again to all of the honorees this afternoon. Thank you so much.
Thank you, Dr. McKinney, for setting the stage so well for our program today. My name is Angie Grover, and I'm a member of the PCI board. I have the pleasure of recognizing our first awardee. Locust Street Resource Center is our 2021 award winner for excellence in telehealth leadership to improve care for underserved populations. For more than 40 years, Locust Street Resource Center, which is based in Carlinville, provides comprehensive behavioral health services in 6 counties throughout the central Illinois region. And while Dr. McKinney focused on underserved populations right here in Chicago, Locust Street Resource Center serves a largely rural region in central Illinois, where access for those needing critical mental and behavioral health services is equally as challenging. We are recognizing their efforts to build and share telemedicine protocols for emergency department crisis assessments to a growing number of hospitals in the region. This reduces the time it takes for patients to receive care by connecting them with an appropriate provider and allows the providers to see more patients. Their mantra of "we are here to help" in the office, via telehealth, over the phone, and right here in your community, "it's up to you, just call or walk in," provides the flexibility to deliver safe and innovative care to their rural population who desperately need mental health, crisis response, and substance use treatment services. Congratulations to Locust Street Resource Center and to Doug Kilberg, who will be accepting on their behalf.
Director here. And good afternoon. As just mentioned, I am the director here at Locust Street. The agency is a not-for-profit community, comprehensive community mental health center serving 5 very rural counties in central Illinois. And it is my honor to be here today. On behalf of my board and my staff, I am grateful and humbled to be receiving this award for our telehealth services. But we were not in this journey alone. We have been partners with HSHS Illinois Telehealth Network for several years now. They reached out to us again several years ago and offered us to participate in a pilot project with them. They were working with local emergency rooms to provide telehealth services for crisis assessments and screenings in those emergency departments. We had been doing this for years, face to face, but this idea was to be able to provide this in a more timely way, more efficient way, using telehealth services. So what we did was we started with one hospital and began to provide services there through teleservices with the idea that it would reduce wait time for patients in the ED. It would free up our emergency room space more quickly. It would cut down on our drive time, and it would provide a similar, if not improved, service. So we collected data, we did our research, and what we found was all those items were actually very successful. We did cut down drive time. What we found was that we could respond to a crisis screening in less than 15 minutes, 78% of the time. Our normal face-to-face response time was from 1 to 2 hours. So that greatly reduced the time for a patient to wait, for ER staff and resources to be tied up. And the end result would be the same, whether we were looking at some sort of deflection or some sort of admission. So we were able to respond then to more folks more quickly because we had more resources. It also reduced my staff's drive time. They were not unhappy with being able to do a telescreening from their home as opposed to driving across several counties at 2 o'clock on a winter morning. So that was very well received here at the agency. And being an old man, I was questioning whether people would find this as acceptable as a face-to-face service. So we did do the data on that, collect the data on that. And what we found was that over 85% of the time, people rated the service as very satisfied. They were very satisfied or highly satisfied. So, it did prove to be a very acceptable and efficient way to provide these screenings. So based on the success we had with the initial hospital over the last 18 months, we've added 2 additional hospitals now, and we are in the process of adding a 4th. That we hope to have happen in the next few weeks. So with these successes, we've looked at what else can we do. We've kind of wrestled with the opportunities that teleservices provide, especially during the pandemic months. This was invaluable in being able to access for helping people access services when there were restrictions. It's great when in bad weather. But what else could we do? So we started to look at how we might assist underserved schools. So we are currently working with 2 different schools, very early stages of talking with them about how we might use the ITN equipment in their facilities, partnering with their school social workers to help access kids that are in that need counseling, that are in kind of pre-crisis situations where we can provide some support, where right now there aren't those services, where the staff are stretched too thin or where there just isn't that capacity. So we are in those early discussions and hope to have that started here, some sort of process started here after the first of the year. The one thing that I learned in this process was that if I had any doubts about how telehealth would work, those have all since disappeared. All my questions and wondering about how this would work or how this would be received have not come to pass. So with each venture, what we have done is identify new ways that we can use this technology to reach out to folks that otherwise wouldn't be receiving services. And have been able to tap those unserved and underserved folks in these rural counties. So I want to say I'm very grateful for this opportunity through ITN to participate in these pilots and in these projects. I also want to say how grateful I am for those folks that are in leadership positions at the state level who have supported this format and who have worked to promote it. And I hope all that will continue. But thank you for that support. So again, I won't babble on, but thank you for this award. I truly am honored and humbled to receive this. And thank you. I enjoy the rest of your conference.
Thank you, Doug, for your work, and congrats again. My name is Siobhan Rary, and I'm a member of the PCI board. I have the pleasure of introducing Laura Hep Kessel in recognition of her critical work in the telehealth space. Laura Hep Kessel is the Director of Telehealth Services at Southern Illinois University School of Medicine. And in this role, she manages telehealth activities across the organization, provides outreach to external partners and connects them with internal resources, as well as serves as SIU's medicine's representative on the Governor's Rural Affairs Council. In addition, she currently serves as the chair of Rural Partners, the state's Rural Development Council. In May 2020, the state's stay-at-home order prompted the highest utilization in telehealth services to date for SIU medicine. Primary care services saw a huge jump in telehealth visits, with 54% of family medicine visits, 81% of general internal medicine visits were via telehealth, and this is during May. Over 95% of the visits in psychiatry were telehealth, 53% were pediatric specialties, 54% were internal medicine specialty visits. And SIU School of Medicine Psychiatry was able to maintain 96% of normal volumes through telepsych services, with patient satisfaction scores that were significantly high. As the pandemic continued, SIU School of Medicine Psychiatry has continued providing almost 50% of mental health outpatient services via telehealth. And this expansion took place despite the many COVID-19 challenges that ranges from digital literacy to scheduling, to access to equipment, to patient marketing and telemedicine reimbursement. During the pandemic, SIU's medicine's telehealth expanded to 97 of the state's 102 counties. So during this extraordinary time, Laura has been leading these efforts. Moreover, her civic involvement, serving as the Fulton County board member, as a member of the Fulton County Board of Health, as well as the state position at the NASW Illinois Chapter Board of Directors, and as a trustee of the Parlin Ingersoll Library Board, has allowed her to spread the word about the work SIU Medicine is doing and the unique challenges it's facing in providing services to rural parts of the state. Laura's leadership is in improving access to care for underserved populations through telehealth has truly been exemplary. And please join me in congratulating Laura Hep Kessel. Thank you.
Thanks to the Partnership for Connected Illinois for their work to advance telehealth across our great state and for this recognition. I'd also like to thank Joel Rubin with the Illinois chapter of the National Association of Social Workers for recommending me for this award. As the Director of Telehealth Services for the SIU School of Medicine, I have had the honor and privilege to work with my colleagues to grow SIU Medicine's telehealth program over the last couple of years. Prior to the pandemic, SIU Medicine was providing what I refer to as traditional telehealth, where we partner with local healthcare organizations to provide telehealth access to patients close to home. But at the beginning of the pandemic, we quickly stood up our telehealth to the home program. We were able to onboard our Department of Psychiatry within a few days of the public health declaration and continue to onboard other departments in the coming days and weeks. SIU Medicine is an organization built on innovation and service, and we had the necessary foundation to quickly transition and enhance our telehealth model to meet the needs of our patients, providers, and community. In the midst of a changing regulatory environment, a new program was created to allow direct-to-patient virtual care experiences to keep people safely at home. This allowed SIU Medicine to expand from 2,000 telehealth visits in calendar year 19 to more than 77,000 telehealth visits the first year of the pandemic. We were able to provide access to care via telehealth for patients in 98 of 102 Illinois counties. This hasn't been easy and it's been a team effort, but I'm proud of the work that we have been able to do at SIU Medicine. We will continue to improve and enhance our program to provide the best care possible to our patients, providers, and staff. I'd like to congratulate all of today's awardees for the work they are doing for their patients and to advance telehealth across Illinois.
Good afternoon. I'm Rick Heinman. I'm a healthcare attorney and PCI board member. I have the pleasure of introducing Trilogy, which is the recipient of the Leadership Award for Advancing Telehealth by Innovation. Trilogy promotes mental well-being by providing equitable access to services, helping its clients achieve purpose, self-determination, and fulfillment. Trilogy serves clients facing mental illness as well as other barriers to stability, including lack of income, homelessness, substance use, and other issues. In March of 2020, Trilogy created a plan that allowed it to continue providing vital services during the COVID-19 pandemic. Trilogy rapidly built telehealth infrastructure to stay connected to clients, which enabled clients to virtually and safely access all their needed services. Trilogy worked to distribute free smartphones and tablets to every client who needed one, providing care for their clients with reduced exposure while addressing increased needs for services. While the COVID-19 pandemic tested it, Trilogy employees worked together to ensure that Trilogy was able to continue providing the highest quality service to its clients. Trilogy proved that it was tenacious, adaptable, and deeply committed to showing up for those who need it. Accepting this award on behalf of Trilogy is Samantha Handley, President and CEO of Trilogy.
On behalf of Trilogy, I am pleased to accept the 2021 PCI Telehealth Leadership Award for advancing telehealth by innovation. Trilogy works to support people in their journey to mental wellness. We provide a broad range of services and supports to people who face multiple barriers to stability, in addition to mental illness. The majority of the people that we serve have little to no income, and many are experiencing homelessness, addiction, trauma, and other issues. Truly has been here to help people for over 50 years, and last year we served 3,200 individuals, all who had unique needs and unique goals for their future. And we did so at a time that was the most challenging in our history. In order for Trilogy to help those that rely on us, we have to be able to connect with them. In March of 2020, we knew that a decisive response to the looming global health crisis would be critical to our ability to continue to provide support to the people who needed us most, because mental health needs just don't wait. Trilogy created a plan that allowed us to continue providing nearly all of our vital services. We rapidly built telehealth infrastructure so that we could stay connected to our clients and enable them to access the services that they needed virtually and safely. We gave smartphones and tablets to every client who needed one, ensuring that clients who are most vulnerable and most at risk during the COVID crisis could remain connected to Trilogy. For the people that we serve, Trilogy is the primary and often the only means of connecting to caregivers. By pivoting to a telehealth model, it was possible to provide care to clients across the city safely during the COVID-19 pandemic. By providing these services at no cost, we made sure that no one who needed help was left behind. For example, Trilogy supports clients with medication monitoring. Before the pandemic, staff would work with individuals in their homes regularly, sometimes multiple times a day, to ensure that clients are taking the right medications at the right time. Because of the speed with which Trilogy deployed our plan and distributed mobile devices, we were able to successfully pivot this key aspect of services online to a telehealth model. These actions and many others enabled us not only to stay connected to the clients who needed us more than ever, but also to address the needs of brand new clients. And we've continued to incorporate telehealth into our practices. What started as an adaptation, a workaround, is now a tool that we've harnessed and are incorporating into our practice so that we can continue providing high quality care to those that need it. While the COVID-19 pandemic tested us, Trilogy employees worked together to ensure that we were able to continue providing the highest quality services to our clients. Trilogy is a lifeline for those who need us. And this award is an honor and highlights the responsiveness and adaptability of the entire Trilogy team, as well as our dedication to providing high quality services no matter what. Thank you so much.
I'm in the legislature, and this year as Speaker of the House, it has been my privilege to work with Leader Greg Harris, Representative Deb Conroy, Representative Thaddeus Jones, and Senator Maddie Hunter. Throughout their years of service to Illinoisans, these legislators have worked tirelessly to fight for improving access to health care for people across the state and help ensure that Illinois remains a leader in the Midwest and the country for innovative solutions to helping disadvantaged communities. This year, their efforts were instrumental in the crafting of extensive telehealth legislation during the spring session. With the pandemic, telehealth is now more important than ever before, especially in reaching rural and disadvantaged communities with limited access to in-person health care. Thanks to the leadership of these legislators, we were able to craft legislation receiving unanimous support, making mental and physical health care services more accessible and affordable to Illinoisans. I am honored to work with them every day for the betterment of Illinois, and I'm proud of the work they have done to deserve this great honor.
Representative Jones, you can go ahead with your remarks.
Thank you, Catherine, and thank you to everyone listening. Let me start by thanking the coalition, PCI Coalition, and also the Executive for Health Coalition, and those that recommended me for this prestigious award. I am honored. I accept the award. I thank you for thinking of me with this. Telehealth is a big deal. When we passed the telehealth bill with me as chairman of the insurance committee, and also want to thank the members of my insurance committee because we took our time to make sure we got this right. We did a lot of work and we listened to the experts, and our goal was to pass a bill that made sense for Illinois, that made sense for what we were going to do in the future. And it was a huge victory for advocates, huge victory for patients, huge victory for the hospitals that rely on telehealth, doctors that rely on telehealth, and mainly the patients that rely on telehealth. So I not only want to recognize them, but recognize the hard work it took to do this and my colleagues in the General Assembly. We not only passed one of the biggest telehealth bills in Illinois, but we recognize that coming out of the pandemic that we had to do something and make the governor's executive orders permanent. The speaker had, I want to thank him for not only his support of me as chairman of the insurance committee, but also for his vision with allowing us to move forward with this telehealth bill because we know it was needed. This bill is definitely going to improve access, patient access to healthcare, patient access in areas where people cannot get to their doctor. So this telehealth bill is going to be an amazing trend for not only the patients in Illinois, but what we do down the road. I also want to make sure I thank Governor Pritzker for signing the bill. I was there at the bill signing with my colleagues. We don't do this for awards. We do this for the people of Illinois. The awards are great, but every day we're fighting for the people of Illinois to have access to telehealth, to have access, better access to telehealth and better access to medicine and seeing their doctors. But this award is kind of puts front and center what we do in Springfield. So I want to thank my colleagues. I know Senator Napoleon Harris carried the bill in the Senate. Maddie Hunter was a huge supporter of this. But we all work together to make sure we're fighting every day for our constituents and the state of Illinois. So on behalf of residents in the 29th district, I thank you for thinking of me with this award. We're going to continue to fight because there's more work to do on telehealth. And I look forward to each and every one of you being a part of us going forward to make telehealth one of the greatest things that we've done in Illinois. Thank you for allowing me to speak. And I appreciate your organization. Look forward to seeing you guys in Springfield. Bye.
Thank you, Speaker Welch, for the introduction, and good afternoon, everyone. I am so honored to accept this leadership award for improved policy changes to advance telehealth. The onset of COVID-19 pandemic exacerbated the need for increased access to telehealth, and I am so happy that my colleagues and I were able to pass this legislation to address the crucial need. Expanding telehealth options provides access to treatment for people with disabilities, people without transportation, and people suffering from chronic illnesses. Access to medical, mental, and substance abuse disorders services are now more convenient for patients. Telehealth is a necessary and safe option for many Illinoisans, and will undoubtedly improve healthcare outcomes and the quality of life for patients. I am so grateful to have been a part of this life-changing, revolutionary efforts regarding healthcare in our state. And I am proud of everyone here who has also contributed to expanding telehealth access for the communities we serve. I commit to fighting for health care for everyone, regardless of skin color, skin tone, and income and background. We have made strides with our telehealth legislation, and I am so excited to work further on the expansion of health care that is accessible and affordable to all. Thank you all, and many blessings to you.
I'm State Senator Napoleon Harris, representing the 15th Legislative District. First and foremost, I'd like to thank the executives for Health Innovation for hosting this event. I'd also like to thank the other honorees for the role that they've played in helping the passage of the telehealth bill. If the pandemic has taught us anything, it's that our health is our most valuable resource, and that through technology, telehealth has helped many people during this time. Telehealth will not only help patients, but doctors as well. Now appointments can be more efficient when in-person visits are not needed, and disproportionately impacted community members will have access to these same services which were not equitably provided throughout the pandemic. This law provides and prohibits insurers that cover telehealth services from creating restrictions or requirements for these same services. Instead, they will be treated the same as in-person health visits for physical symptoms. Telehealth services are an efficient way to provide people with remote access to quality healthcare services. Illinois is now a leader in this, and I take pride of the passage of this bill. Illinois residents who cannot leave their homes, particularly for fear of COVID-19 pandemic, can stay home and still receive those same services from their dedicated physician. Expanding telehealth services makes Illinois healthcare more equitable. Let's face it, Illinois is moving forward, and we must embrace the future of healthcare. Thank you, and I'm humbly honored to receive this award, and I look forward to continue working with you in the future to continue working on telehealth and healthcare services here in the great state of Illinois. Thank you.
Thank you, Speaker Welch, and thank you for all of your support in helping us get this legislation done. Your leadership has been invaluable in this last General Assembly. I would very much like to thank the Partnership for Connected Illinois for this award, but this award really is better suited for the coalition and the group that I had the privilege to work with, including the Hospital Association and the Med Society, as well as Thresholds, Kennedy Forum, and Early Intervention. There were so many amazing people that came together. We had a huge disappointment a year before this in not being able to pass a bill, and therefore got together with this group and the advocates and worked tirelessly for a year to get the legislation that now gives Illinois the strongest telehealth legislation in the country. This is the future This is an open door for us, and now so many people will be helped by this legislation. Telehealth is going to save lives and connect people to the ability to have the care that they need that they were never able to get prior to this. So thank you so much for this incredible award. And again, this award I share with a coalition of people that came together to help our communities and to create a system that will allow people to get past barriers in healthcare. And again, thank you.
Thank you so much. Our next award recipient is the Coalition to Protect Telehealth, which is a diverse coalition of healthcare providers, professionals, and patient advocates. As you will soon hear from AJ, Courtney, Marvin, and Ollie, this multi-stakeholder group has led the charge on making incredible changes to telehealth in Illinois. This type of collaboration really exemplifies the positive change that can happen when thought leaders, like the leaders of the coalition, will come together and commit to a cause. But before we introduce the coalition and present their award, we'd like to first show a really moving video that illustrates the power of telehealth and why telehealth access is essential and how the coalition's work has made a real life impact. So thank you to the Illinois Primary Healthcare Association who provided this really moving and wonderful video. IPHCA is a network of different community healthcare centers in Illinois, and just a wonderful organization. And the patient who you're about to hear from was a patient of theirs at the Near North Center.
Hi, good morning. My name is Marietta Galero, and we have been here in Chicago since 2012. And since that time, I have been with Near North with our important health issues. They are my shoulder to lean on regarding everything that is concerning our health. They have been very kind-hearted. They are good people. We cannot leave them. They really give their help. Like last year with the height of COVID, we have some issues with my grandson. We only have the telephone on the first week. Second week, we were able to talk to the doctor, but at least the third week, she was able to see my grandson, and she was able to assess him, and with her help, with her assistance, we were able to bring him to the hospital as soon as she say. And that's why I said telehealth is really very important, because medical professionals can talk to you, they can see how you talk, how you communicate, how you feel, how you look. They can assess you even if you are not with them. So with that, I really say that it is very important, especially for people who cannot go out of the house, who cannot be with the doctor for some reasons. Also, in our case, even if we have the insurances and they give us our PCP, I really insist that we work with Near North. And especially this season, the COVID-19 issues, it's very important to have telehealth. Thank you.
Hello, everyone, and thanks to Lisa Mazer for that very kind introduction. On behalf of the Coalition to Protect Telehealth, I want to thank the Partnership for a Connected Illinois for recognizing our coalition with this leadership award. The Coalition to Protect Telehealth is a diverse group of 36 healthcare and patient advocacy organizations, including IHA, and we came together earlier this year to urge the General Assembly to take bold action that would protect and expand innovative telehealth services so all Illinoisans could continue to safely access critically needed virtual care beyond the COVID-19 pandemic. And the coalition united around key policy principles. We coordinated surveys across the state and collected research to demonstrate how telehealth is used. And then we collectively shared this knowledge with the Pritzker administration, with the General Assembly and the public to show the impact that virtual care has had across our state. Our coalition's coordinated efforts resonated with policymakers and the Pritzker administration. And I want to thank the General Assembly for passing groundbreaking telehealth legislation, House Bill 3308, unanimously. And I also want to thank Governor Pritzker for signing this bill into law. Because of their leadership on this legislation, Illinois' telehealth laws went from worst to first in the nation by codifying coverage and payment parity for state-regulated commercial insurance, while also ensuring strong patient and provider protections. So again, we are very grateful for this recognition, and I'm honored to accept this award on behalf of our Coalition to Protect Telehealth Partners. And now I'm pleased to introduce Courtney Heteron, the Associate State Director of Advocacy and Outreach for AARP Illinois. Courtney leads AARP Illinois' telehealth work and has provided a very important consumer voice to our coalitions. Courtney?
Thank you so much, AJ, and thank you so much for the Protect Access to Telehealth initiative, for the hosting of these awards. Really a heartfelt thank you to all the organizations, sponsors, and champions that helped to make this happen. This was an amazing coalition collaboration, and AARP was thrilled to be a part of it. AARP engaged our grassroots leadership, engaged lawmakers with a toll-free hotline for the 50 plus, hosted a statewide teletown hall, and of course sent a letter to the governor to sign that bill into law. You know, AARP really believes that telehealth holds the promise of improving access to healthcare, including long-term services and supports in new ways and making it easier for family caregivers to care for their loved ones. The use of telehealth technologies for the delivery of healthcare services, especially those that include family members and virtual visits with providers, has and will continue to have the potential to result in better access to care, reduced transportation barriers, and improved outcomes for the care recipient. Now, during the COVID-19 pandemic, temporary changes made to expand and advance telehealth use has really proven how valuable telehealth is to thousands of Illinoisans. Telehealth has brought care to patients rather than having patients travel and put themselves and others at risk for possible exposure. So in the future, greater use of telehealth services would continue to increase access to health providers, particularly specialists, to facilitate the sharing of clinical information for evaluation and allow older Illinoisans to remain in their homes and communities. As we consider the future of telehealth, a primary goal must be to improve equity in access and outcomes for vulnerable groups. Telehealth strategies must be designed to be accessible and usable by those with the greatest need. You know, ultimately, healthcare systems really must ensure that healthcare reaches the most vulnerable, including communities of color, and narrows rather than widens healthcare disparities. Notably, the use of telehealth can also address the needs of family caregivers who often really struggle to care for their loved ones. These needs include reduced time and stress involving transporting a loved one to appointments, improved caregiving knowledge and skills, and greater confidence in their caregiving roles through telehealth education platforms. Again, AARP applauds the efforts already gained, and we look forward to working together to bring telehealth forward even more. Thank you so much again for this award. Now it's my pleasure to introduce Marvin Lindsey, the incomparable Marvin Lindsey, who is amazing. He is the CEO of the Community Behavioral Health Care Association of Illinois. Thank you so much.
Thank you, Courtney. I would like to thank the Partnership for Connected Illinois for this award that recognizes the hard work of the Coalition to Protect Telehealth, which my association is proud to be a member of. Please allow me to acknowledge the important role in the coalition of the Illinois Hospital Association. Their leadership, resources, and inclusiveness were essential in the success of our work. I am also very proud of my association's board of directors and members who made this legislation one of our top legislative priorities. And we backed it up by making phone calls to legislators, testifying, and heavily supporting the legislation in committees by submitting support slips and letters of support. I could not discount the importance of the coalition's legislation in helping people like the farmer with severe depression in Southern Illinois, who is now able to keep his therapy appointments from the comfort of his tractor or barn and not have to travel 30 miles one way. The law has also masterfully eliminated barriers that have long restricted access to treatment for people with substance use and mental disorders. Many individuals with opioid addictions have found telehealth to be a lifeline. The legislation has undoubtedly been a major factor in making sure people with mental illness and substance use disorders are able to continue to receive this life-saving mode of delivery after the governor's emergency order has ended. This legislation is also helping to address the unprecedented behavioral health workforce crisis that our industry is experiencing. The law has helped to extend the reach of the existing depleted workforce, which is so essential in meeting the increased demand brought on by the COVID pandemic. Again, on behalf of the Coalition to Protect Telehealth and the CEBA Board of Directors, I thank the partnership for this award. Now, please allow me to introduce my friend, Mr. Ali Idowu, President and CEO of the Illinois Primary Healthcare Association.
Well, thank you, Marvin, and thank you to all my colleagues, AJ, Courtney, thank you all. I will start by saying that we all know the impact these past 20 months have had on healthcare. It's been extraordinary, and many of us have witnessed our members suffer under some very tough working conditions, yet we also witnessed our members rise to the challenges in front of them. But one challenge we all rose up to is this challenge of telehealth. And it's a big one, and we should all give ourselves a round of applause. In many ways, in some cases, actually, our members were forced to create a fully functioning telehealth program in days, just to respond to the needs of the already hard-hit communities. But I'm happy to say the future of telehealth in Illinois is just the beginning. And with the hard work of this coalition, so many others on the front line, we can't forget those on the front line. I think we'll be able to shape the future of what telehealth and what healthcare looks like, at least from my perspective, for the 1.4 million Illinoisans who receive primary healthcare through a federally qualified health center. I also want to highlight that when our coalition works together, we can achieve some amazing things. For instance, I would say our advocacy efforts have helped bring monetary awards to our members that allow new investments in technology to directly provide healthcare to vulnerable populations. And because of that, IPACA is very proud to be a part of this coalition. Together, we will continue to work to reduce healthcare inequalities, improve health outcomes, address social determinants of health, and rectify the difficulties underserved communities regularly face to access quality healthcare in the state. Again, we are proud to be a member of this coalition and to work with an amazing group of organizations who are part of this coalition. Together, we'll continue to move healthcare forward in the state of Illinois. And on behalf of all of us, I want to say thank you for this award.
Now, I am honored to introduce Congresswoman Robin Kelly. Throughout her more than 8 years in Congress, she has been dedicated to improve access and overall wellness of vulnerable communities across the country. Serving on the Energy and Commerce Subcommittee on Health, she has been able to shape the latest healthcare policies in the nation, working to remove barriers to accessing care. She has worked on promoting health equity through promoting innovation with technology and telehealth. Congratulations, Congresswoman, on this well-deserved honor. And thank you for your leadership in Illinois and in Washington to improve the health and well-being of everyone in our country. After her, you will see a video from Lurie Children's Hospital to hear the powerful story of a young child named Gabe, whose family lives in Congresswoman Kelly's district. I hope you'll take heed of that message, and thank you for your time.
Hello, everyone. I'm excited to be speaking with you today, and I am so grateful and humbled that you have chosen me as a recipient for your Telehealth Leadership Award for improved policy changes to advance telehealth. Our country is facing a healthcare crisis, and I believe that broadband and telehealth can play a role in how we improve our healthcare system to work better for everyone. Communities of color, rural communities, and low-income communities face many barriers to accessing healthcare access. These barriers can include transportation, financial constraints, and not being able to take time off from work to see a provider. Take, for example, the maternal health desert in the south side of Chicago. Years of closing obstetrics and gynecology departments and closures of entire hospitals have resulted in limited access for expectant and new mothers. This means that pregnant women must either figure out where or how to get care somewhere else, and unfortunately, too many women simply aren't able to find a provider. Earlier this year, the Illinois Department of Public Health released a report showing the disproportionately higher rate of maternal mortality and morbidity for Black women. One recommendation offered by the review committee was to increase telehealth coverage on health insurance plans. During the pandemic, the healthcare system shifted towards telehealth services to limit doctor and patient exposure to COVID-19. However, as we begin to move past the pandemic, we should capitalize on the momentum of telehealth technology and continue utilizing this tool to bring healthcare to underserved communities. With the expansion of telemedicine, more doctors are offering virtual appointments and patients are connecting with healthcare providers via their laptops and cell phones to access mental health care, manage chronic conditions, and detect possible illnesses. This virtual connection allows patients to bypass so many of the physical barriers that prevented them from managing chronic conditions and assessing preventable health services. Telemedicine can be the great healthcare equalizer if we implement it properly. Earlier this year, I introduced the Evaluating Disparities and Outcomes of Telehealth during the COVID-19 Emergency Act to develop data-driven policies for telehealth. As I said, telehealth has the potential to equalize healthcare access for underserved populations. However, we need data to understand telehealth utilization, cost, fraud, and privacy in order to serve those left behind by the digital divide. Today, we have the capacity to knock down the various barriers, close the healthcare access gap, and bring healthcare into people's homes, especially for folks in places that have been locked out of the system for too long. We must use this moment to build the needed investments and structures so everyone can access broadband internet and the digital technologies needed for telehealth services. We are going to need to invest in the broadband access. We know that many rural communities right here in Illinois struggle with broadband access. However, reliable high-speed internet can be an issue of cost in urban areas as well. The Build Back Better Act invests in connectivity to advance communication technologies and increase access to affordable broadband for low and middle income consumers. It also provides additional funding for the Emergency Connectivity Fund so schools and libraries can provide access to internet and connected devices. This will help unconnected populations get online and be able to use telehealth services. It will mean that folks living in rural areas can talk to their providers without having to drive an hour or more just to get to where their doctor is located. Additionally, Telehealth may remove the stigma associated with accessing healthcare services like mental and behavioral health by bringing services directly into people's homes. This is especially important for the elderly and for children, for Black and Latino populations, and for caregivers and essential workers who have all experienced increased mental health issues during the pandemic. I am working in Congress to do whatever it takes to expand access to broadband and to make telehealth a reliable option for people across the country. Thank you for your work to keep Illinoisans connected, and thank you again for honoring me with this award.
My name is Amanda Snyder. I'm the nurse coordinator with the Single Ventricle Center of Excellence at Lurie Children's Hospital in Chicago. I am the nurse coordinator that works closely with Gabe and his parents, Karina and Gerardo. I met them prenatally before Gabriel was born, when he was first diagnosed with a severe form of congenital heart disease. I work closely with the family in our interstage home monitoring program. We monitor a multitude of things outpatient, including his oxygen saturations, his heart rate, his weights, all of his formula intake, and we also do weekly telemedicine calls. Gabriel's family is very young. It has posed challenges. Mom is trying to complete school. Dad is now out of school and working full time. The family does not live nearby. They're almost an hour away from the hospital, and each visit requires the time and money of transportation. And it's difficult to come down to the hospital for multiple clinic visits. He has not just congenital heart disease, but also Bacterial syndrome that incorporates multiple other organ systems. He needs considerable developmental therapy to meet all of his needs. There aren't enough days in the week to incorporate all of those clinic visits and still be able to live a normal life at home and provide financial support for their family. So telemedicine has really helped fill in so many gaps for this family. Our program at Lurie has incorporated telemedicine into every aspect of our care for patients like Gabe, who are very high risk in a period of rapid growth. There's a variety of monitoring that we have to do of these patients that without the help of telemedicine and technology, we would not be able to do it on an outpatient basis. Congresswoman Kelly, on behalf of Gerardo and Karina, I want to thank you for all the work you have put in to help get patients like Gabe the access to the care they need. Thank you so much for everything you have dedicated, and I congratulate you on this amazing award.
Well, thank you to Lurie Children's for sharing that incredibly moving and powerful video. And with that, we'll be concluding our program for today. We would really like to thank our amazing donors and sponsors. And again, we wouldn't be able to do this without your support. We're very grateful, as well as the awardees and the nominators. A special thank you to Nancy Kazak, who's our executive director and really the heart and soul of Partnership for a Connected Illinois, as well as the executive for Health Innovation for organizing and hosting us today. This recording will also be available on the Partnership for a Connected Illinois website. If you had to depart early or if you'd like to share it with anybody else, a copy will be available on the website shortly. Thank you again for joining us, and we hope you all have a wonderful day.